They're using steroid for that. When they're using steroid in form of tablets, inhalers, sprays, creams, ointments, eye drops. Steroid use anywhere in the body in any form puts you at a high risk for getting it. So fortunately, a good fraction of people are not responsive to steroid, but 35% of people, their body responds to steroid by increasing the eye pressure. And 35% is a big amount. So whenever I use steroid for any duration longer than a week's time, one should avoid eye examination. So regular eye examination is again a must. So the potentially vision-threatening disease, potentially blinding disease, the take-home message for glaucoma is that the regular eye examination is a must after the age of 40. And anybody who's got any of the risk factor should then get their eyes examined. Any questions you have on glaucoma, we have to answer. Or any question you have on any subject related to the eye.
Eyes are the sight is the most precious thing. Just for the sake of getting understood, what is the cost factor of eye? What is the cost of getting operated on average?
Average cost for eye surgery?
Yeah.
Say if you have to go for the MICS, with a unifocal lens implantation, it is typically in the range of about 35-40,000 or so. If you have to go for MICS with multifocal,
one eye.
If you go for say multifocal lens implantation, the cost kind of becomes double with the lenses more expensive. For glaucoma surgery, again the cost would be approximately 35-40,000. But glaucoma surgery is required very rare. Mostly glaucoma is managed by the drugs, by the eye drops, and but yes, the regular tests are to be required. So every 3 months you have to get your pressure checked. Every year you have to get a specialized test done. The costs, though they're high, but they are much less compared to any other specialty. So if you go for any cardiac surgery, what we talk in terms of thousands, we talk in terms of lakhs. So costs are much less. And again, the cost being actually less, that eye surgery has been supported very heavily by the government for a long time, and being done at a very high scale, large scale, very important part of the body. The costs have come down. The laser costs right now are high. So if we do the femto laser surgery, it will be the tune of 1 lakh. But hopefully, as more lasers come into the market, as cheaper lasers come into the market, the cost of that will go down also. But that may happen in about 10 years' time.
So what you are saying, 30,000 for one eye?
35 for 40,000 for one eye with the use of unifocal lens by MICS. By
laser?
No, the laser will cost you 1 lakh. The femto laser surgery will cost you 1 lakh with the same kind of lens.
Per eye. That means 2 lakhs.
That means 2 lakhs.
Surgery will be 30,000.
The MICS, the other surgery, will do 35 to 40,000.
So why there is such a big difference?
The equipment cost. The machine costs 5 crores. The laser machine is 5 crores. And so there's the cost of material involved there, the cost of the machine involved there, the manpower involved there. So all these things they are different.
So what is the right way to do? One should go for a day.
So the question is whether to buy a Maruti 800 or a Maruti Alto or to buy a Mercedes.
Maruti 800 is much convenient than a Mercedes.
Yes. No, there are smaller Mercedes also, A-class Mercedes also there. So sometimes the choice is that. And actually it's a wrong comparison. The choice is more of, say, buying a mid-segment safe car versus a luxury premium car. Naturally, the digital car is more premium, has got some advantages also. It's more comfortable and safer also. But the difference is not too big.
A person like me who has to pay out of his pocket, what should I do? What will you advise me to do?
Sir, it's a very personal thing. Whether Titan watch or a Rolex
So
watch.
I can't take a risk with my eyes, that's for sure. Under any circumstances. What should I do? Surgical is as safe as laser.
Both are safe surgeries. But the degree of safety is slightly better in this.
Slightly.
It's not, as I said, not Zameen Asman ka antar. It is 20 ka antar.
How do I select a doctor?
How did you say to
There
doctor?
are 80 doctors or 45 doctors.
Choice and wine, sir. That is the answer.
That's not the answer.
Okay, no, this is a very important question. Very serious.
I'll tell you one thing. I went to an eye hospital. they said if you go to this doctor, you have to pay X.
Yeah.
If you go with this doctor, you have to pay Y. If you go with this doctor, you have to pay this much. How do you find out which is the most expensive doctor? Maybe the worst even.
That's the lens you said.
What should we do it?
Sir, that's why we at Max follow more rational style of working. Doctor A, B, C, D, X, Y, Z, we all cost the same. So there's no difference.
Leave costs. Leave costs.
And, so the question, the most important question is how to choose a doctor.
Yeah.
And I think this is the most difficult question even for a doctor. You have to do your homework well, your research well. And the most important way is that you should talk to people, your friends and family who experience the doctor. And take their opinion. And do your research on the net about the doctor of the place also. And then make a short list. And then maybe go meet a couple of doctors. There's no harm consulting 2 doctors. There will be a second opinion also. Plus you'll be, you get opinion about your eyes and you'll form your opinion about the doctor as well. So you go to 2 doctors but not go to more than 2 doctors.
It's like marriage. You don't know what you're getting.
It's very easy, much easier to divorce a doctor than to divorce your wife.
But be positive only. You have to think positive.
So, but this is a very, very important question. And I think that going and meeting maybe 2 doctors is not a bad idea. And when you meet a doctor, if you use your common sense, see, you are all very, very senior people. You've lived your life, you've seen this world, you've seen people, right? I think within no time you can make a judgment about which person is genuine and which is not genuine. So I would say that you should look at the genuinity of the person, rated as the first criteria, the most important. Why? Because technology these days is more or less the same. Skill level is more or less similar. And slight variation in skill level will not affect the results at all. All the doctors they would get to hear about are usually good doctors, good surgeons, have got access to good facilities also. Good infrastructure, everything is fine. But it is these days, in present times, it is the intent of the person. It is the integrity of the person where there is a lot of variation. Not just in doctors, but across the society. So, the critical variable here is the integrity of the person, be it doctors, be it lawyers, be it politics, be it people walking on the road also, people driving on the road. Somebody who stops the car at red light, the other would just go jump it also. So that is what you have seen. So it is not the car which is being driven which is important, it's the person who is driving the car which is important. So will this person slow down before the red light and stop when the light will go red or not? Or is this the guy who will just see that there's no policeman standing in front of him? So this is your simple distinction between the doctors also. So which doctor will jump the red light, which doctor will stop at the red light? You will decide. Once you decide
How
that.
can you get so much knowledge about a particular doctor who you may meet under professional circumstances?
Sir, I said that you people are all senior, you've seen the life, you can make judgment about a person in very, very short time. But plus,
We've all made our mistakes in very so
that's why I said, you look at the human side of the doctor more than the commercial side. Right. The most expensive doctor, as you said, may not be the best doctor.
Yeah.
So you do by that. And a starting point for your research would be, opinion of your family and friends who had their first-hand experience with the. Second point would be go onto the net and research about and then third is go there and make a judgment.
net, all the netting are beautiful and everything.
Yes, you should read about the disease. No, you should be ready with your question. Then you will be able to judge
Let's say
the person.
you have whatever level of knowledge of the disease. It's now a question of who is going to solve that disease for you. So that you can't tell from
Not a simple
your
straight
question is
Very
a very good one.
It's actually very, very difficult
It's a
question.
very major decision,
Yeah.
especially in this case being eyes and so
No, I
on.
was surprised. He'll charge this much, he'll charge this much, he'll charge this much.
I don't think you should go by the chart. That's all.
That's
Charge
the way
is
it
not
should be.
Sir, I am a thyroid patient. I just want to know if I keep my thyroid level in control, I am taking regular medicine, even then I am at risk.
The risk of glaucoma does not depend on the thyroid level.
Okay.
They both have common predispositions. So, genetic factors which can cause thyroid disease are also known to be associated with glaucoma. So the risk factor is high. So it's not that the thyroid level is causing glaucoma. It is the common, they have a common, they come from the same family. So that's how it is. So they have a common genetic predisposition to these two. So you should get yourself examined regularly. And if it is ruled out, then you can be safe. You don't worry about the thyroid level being affected in the eye pressure. Is there anything else to add?
नहीं बस वही है because ये incidences मतलब आपका जैसे normal population में if there are 100 disease free normal people उसमें glaucoma incidences 3 to 4% prevalence मतलब 100 में से 4 लोगों को glaucoma हो सकता है. अगर हम यही 100 normal people we make them thyroid people, the incidence will be probably 6 to 8%. Similarly, in a diabetic population of 100 people, the glaucoma chances may again be 6 to 7%. So the chances increase only because they are genetically linked. As you rightly said, it's not related to your thyroid pressures. So just comfortably once a year go for your routine eye pressure check and that's fine.
In diabetes, it's related to the control of diabetes. So if your control of diabetes is not good, then it leads to deposition of a substance called mucopolysaccharides. So that diabetes control is important for prevention of glaucoma. Unlike in thyroid. No, dry eyes does not lead to glaucoma. Steroid intake, local or oral, does not.
How the treatment of glaucoma tends to be dry eye.
Treatment of glaucoma
Can cause dry eyes. The eye drops.
That's
The management of dry eyes.
Okay, at least that way.
Yeah, I was also trying to ask the similar thing. I had glaucoma, symptoms. So I've been getting my tests, field tests and all that every 6 months or so. So that's no problem right now. But the dryness of eye is a big issue. Because these days, whether I see the projector or I see the TV screen or the laptop, it creates a lot of, although all those precautions that you close your eyes, rest your eyes, wash your eyes, all those things we do, but that has been a bigger problem. And the natural tears and all those medicines does help a little bit, but it's not being a solution. And perhaps the eye layer is very thin, it is generally reddish, and it creates a lot of uncomfort and the muscles also pain. So for that they said that there is a duct which goes from eyes to I think throat, which is choked. So I was advised that you check up. I mean, maybe it will need some surgery. But then the plastic surgeon who does it, he said no, it's okay right now. But the problem which I would like to come to you sometime is the dryness of eyes and the tears not going out. Supposing I put medicine in eyes, it should get me taste in the throat. It doesn't come sometimes. So that creates a lot of uncomfort. In spite of the exercise and all that, it's not a comfort.
Two questions are kind of overlapping, the dryness and this. Now, I like grouped two different forms. There is one thing called dryness, dry eyes, and there is also, you can say, a general discomfort of the eye.
Yes.
So what you're referring to is more to general discomfort, what you're talking about is the more dryness in the eye. Often you mistake one for the other. With age, the eyes do get a little more dry, more so in females than in males. And things like thyroid and all cause more dryness. That is normally bound to happen with age. Some people get dryness in itself, as a disease itself. That the eyes, the tear secretion in the eyes must less, the tear film is disturbed. Those are the patients who would need constant use of artificial tears or tear secretions. But many a times, what we call dryness is actually an eye strain caused by our lifestyle. So spending a lot of time reading or looking at any screen, be it phone screen, laptop, TV and all, does put a lot of strain on the muscles of the eye, does cause the eyes go temporarily dry. Because when you're staring at a screen, our blinking frequency goes down, the tear evaporation increases, our muscles are constantly strained. We find it's a very simple thing, but why should call it simple? It does. It's like if I ask you to stand like this for a minute or half a minute, it's very simple. We say now maintain this posture for next 2 hours. What will happen? After half an hour, it will happen. We do this to our eyes day in, day out. If you look at any screen, be it TV screen, watching a serial in front of the TV, or reading, so look at the computers, our muscles are constantly gazing at it. And we get lost. We get lost in that, eyes in that position, blinking goes down, tear evaporation happens, dryness happens, muscle gets strained. So the solution for this is that frequent breaks are required. So every 10-15 minutes sit back and close your eyes for it. Every hour or so take a short break and come back. Try to blink more frequently consciously. strengthen your muscles by doing regular eye exercise. Use of lubricant eye drops in this situation may help a little bit, but should be kept to a minimum required. So once you know that it is the muscle strain, muscle weakness, and constant use of screen which is causing the problem, you will know how to deal with it also. Whereas if a dryness is happening because of the tear film disturbance, you have to use artificial tear supplements. If there is any inflammation of the glands in the eyelids called memoritis, you treat that also. If there are any drugs and all which are being used which may be causing dryness, you may have to try to eliminate those drugs. But that's a totally different condition. Mostly this is the thing. Another important point which I would like to bring out here, and just we may not really like to hear that, is the hair color. I find that most people above a certain age group are using hair color now. In my experience, it's not documented in the literature. In my personal experience, I've seen that hair color is associated with a lot of problems in the eye. Simplest would be constant soreness, redness, irritation, dryness. Slightly more, it would be inflammation, uveitis in the eye. It can cause glaucoma in the eye, it can cause cataract in the eye. And we don't really realize why, because we've been using them for years. No, you say, if I've been using this for the last 10 years, I've not changed my brand, it's the same brand, why should be allergic? No, not allergic, it is a toxic effect. And one may think, why does it happen? It should have only, people often say, we were very, very careful, we go to the parlor and then they do it for us, with their gloves on and we have eyes are all completely covered. No. The chemical is there in the hair. It is either shedding into the air constantly for the next few weeks to come, or it's getting into the skin also. How it is working, how it's reaching the eye, how it's fitting the eye, I can't really give you scientific information at the moment, but it does cause effects. So be careful. What you can do is you can do a trial. That once, if you're having the symptoms like this, give a long gap between your hair color application. Say delay it once. And see how your eyes are feeling after a couple of months of not using the hair color. Then use the hair color again, and then see how you feel. If you think that you were very, very comfortable when you had not used the hair color for 3 months, and after using it, again the eyes is generally sore and not comfortable, that means is probably causing you
Shall I tell
discomfort.
you something? If once you use stopping hair color, you will never do it. You will never do it. I can bet it.
Here we are.
Getting harm after post surgery to not even to wash your eyes with water or
We say
tap water.
for 1 month you should not splash water into the eye. Water does not cause any harm to the eye because even medicines have got water in it. But if there is any contamination, infection in the water, and then that goes into the eye. And you can never be sure of the water supply in Delhi. So you should avoid. For a month's time, it's better to avoid the water from entering.
After that,
After
in
a
the
month,
long run.
long run it's fine. But washing your eyes too much, it does not help. Once in a day in the morning is okay, maybe twice.
Mineral water for washing the
If you're sure of mineral water for we are living in India.